The healthcare debate, while many are complaining about Obamacare, our next guest is prospering from it, and he says now's the best time of any for healthcare entrepreneurs. And we're joined by Dr. Brad Weinberg, a partner in Blueprint Health. Thanks for joining us. You're a young guy, and you have an MD, but you've never been a practicing doctor, and yet you certainly have been an investor. And your group has put $20,000 apiece into 30 separate little startup companies just since 2012, all in this healthcare sector, and yet a lot of people say, oh, no one wants to invest in healthcare because of Obamacare. So why is now a good time?
Now is one of the greatest times to invest in healthcare companies. I think we're going to see as many millionaires that were created by the internet era, the Facebook and Google millionaires, in healthcare over the next 5 to 10 years. And people are putting that money to work. We've seen a 50% increase in the investment in digital healthcare IT over the past year. Over $1.5 billion went into digital healthcare in 2012 alone, and we're on pace to break that in 2013.
How can individual investors get a piece of this? Can they put money into a firm like yours that then goes out and plants seedlings into these healthcare companies?
They can invest in individual early-stage companies if they're accredited investors. And there's going to be a lot of new opportunities to invest in private companies, which is what we do. We invest in private companies very early stage, but there's also great opportunities to do that in the public markets as well. There's large companies that are really taking advantage of reducing healthcare costs and trying to take advantage of healthcare IT, the EMRs of the world, where they can make those investments in public companies as well.
Okay. Let's talk about some of the little startups you've been investing in. You have one app called Touch Surgery, which helps the surgeon train for a procedure?
Yes, this is an amazing application that was built by 4 surgeons themselves, who are also developers, software developers.
Right.
And they've walked through the process so that a surgeon can see every minute step that they need to do, and their training physicians or surgeons can see if they actually knew those steps appropriately. What's also cool is patients can use those as well, so that they can see the surgery that their surgeon is about to do on them before they go through it, if they want to see it.
Yeah, not sure I'd want to know that, having had 5 surgeries myself over the years. Now, how many of the things that you're looking at, though, are about making care better, giving me a better imaging machine that I can look inside a patient with, versus how many are making bookkeeping better? I have to abide by all these new regulations, and so I need tools to do that.
The majority of what we do makes care better or provides physicians or care providers with more time to actually take care of patients and do the things rather than doing the paperwork that everybody's so frustrated with.
Right.
So for instance, one of the companies that we've invested in, Intelligent M, they help physicians know if they've actually washed their hands in hospitals. One of the biggest killers in hospitals is people getting infections.
So it sounds a little alarm or something if I haven't washed my hands on the doctor?
You have a band that you're wearing. The nurses, the physicians have this band that if you walk in and you don't wash your hand, it tells you.
All right. I'm liking it. Thanks very much for being with us, Dr. Brad Weinberg, and good luck. Happy hunting.
Thank you.
All right.